is about taking over 100% of the people's insurance in this country.
If we do absolutely nothing, Obamacare will be implemented, and it's going to change the face of the country forever. It's going to cost trillions of dollars over the years. It's going to take away our liberty.
What was the key element in those statements? The fact that the federal government is telling us what we have to do and they could tell us if they could do health care, anything else? Or the cost and the fact that this nation could go bankrupt on Obamacare?
I think they're both equally important. And the first point on whether we can be mandated to do this is particularly important for the Supreme Court case. And it'll be very interesting to see where Justice Kennedy falls on this issue, because he's going to be the deciding vote. In terms of the cost, I think we cross that bridge after we see what the court has to say. It could be that parts of the law are going to be ruled unconstitutional, whereas others will be okay. In that case, we need to revisit exactly how much it's going to cost us. Generally, I think that Governor Romney has some problems going forward talking about this, because the nuance that he did it on the state level, whereas the president did it on the federal level, might be lost on some who just think that mandating health care is a bad idea.
I just wonder, Richard, whether that's such inside baseball. Can the average American voter understand what the Romney plan was, what President Obama wants, and what's right for this nation?
I think the average voter can understand that, Jamie, and let's break this down for just a second. So you look at the health care bill that currently exists. While the exchange has not been implemented yet, we've already seen some of the good impacts of this health care bill. 1 million young people from the age of 18 to 24 have been able to go back on their parents' health care insurance. And that hasn't caused the economy to blow up. It hasn't caused the health care industry to go asunder. It hasn't taken away anybody's liberties. It's just given people more opportunity to good health care. What Mitt Romney's problem is that in Massachusetts, he implemented the same exact plan. The same exact plan that the Obama exchange is basically Romney care. So that's his problem. And Michelle Bachmann's problem is, while she says we want to repeal health care and we want to repeal Obamacare and we need to stop all the liberty, they really haven't figured out a solution in the Republican Party on how they deal with those that are uninsured. John McCain earlier on Sunday said the same thing for immigration. The Republican Party really hasn't figured out a way to deal with immigration that is genteel, that allows them to pick up voters that sort of see this as a benefit. There's a lot of people in Republican red states that their kids are now back under health care insurance, and they wouldn't have had health care insurance otherwise without the passage of the Health Care Reform Act.
Well, we're going to talk about immigration as well as a hot button.